Good afternoon. Joining me today are Deputy Health Secretary Fran Phillips and Assistant Health Secretary Dr. Jinlin Chan. Yesterday I had another conference call with Vice President Pence, the nation's governors, and the White House Coronavirus Task Force. We're continuing to press the White House for an extension of Title 32 authorization so that we can continue essential COVID-19 relief missions. And the NGA continues to work diligently with the administration and leaders on both sides of the aisle in Congress to reach a bipartisan consensus and to try to finalize an agreement to provide desperately needed additional federal funding for the states in the fourth stimulus. Yesterday, we also held another conference call with the Maryland Coronavirus Recovery Team, which includes some of the smartest scientists, public health experts, and business leaders in America. Following our science and data-driven approach, and in collaboration with our team of experts, we continue to closely monitor all of the public health metrics in Maryland, as well as the spiking numbers in states across the country. Yesterday, the federal government identified 21 red zone states with rapidly rising positivity rates over a 14-day period. And they urged them to shut down parts of their economies and to place limits on social gatherings. Maryland is not on that list of 21 states, and we do not want to be on that list. Our numbers do not warrant those types of actions, but we are not immune. The virus does not recognize state borders. However, we do find ourselves in a fork at the road, a critical turning point where we could either continue making progress and continue heading in the right direction, or we could ignore the warnings and spike back up like much of the rest of the country. And we're making every effort to keep Maryland safely open for business. And we do that by making sure that everyone is following the public health guidelines and by doing the things necessary to keep us from looking like those other states. Reversing course and shuttering businesses for a second time has proven devastating to the states that rush too fast and reopen too soon. And we're doing much better on our health metrics than much of the rest of the country, and we are doing much better on our economic recovery than most of the rest of the country. And we want to do whatever it takes to keep it that way. We've come too far together to lose the progress that we've made on the road to health and economic recovery here in Maryland. Thanks to a robust long-term testing strategy and our strategic stockpile of test kits, we successfully have increased our testing capability dramatically over the past month. As expected, this exponential increase in the gross number of tests, which is now at more than 1.1 million, has resulted in an increase in the number of positive cases that we have identified. However, through our continued aggressive efforts to fight the virus, our 7-day positivity rate, the key indicator that we track, is at 4.77%, and it has remained below the 5% goal, which is recommended by the World Health Organization and the CDC, for 34 consecutive days. Only 3 of Maryland's 24 jurisdictions, Baltimore City, Baltimore County, and Prince George's County, have positivity rates above the 5% threshold. We continue to be aggressively trying to tackle local outbreaks. 9 days ago, Worcester County had the highest positivity rate in the state at 7.26%. It's now down to 4.55%. A drop of more than 37%. Queen Anne's County seemed to be spiking just 18 days ago, with a positivity rate of 8.38%. Now, Queen Anne's County is down to a positivity rate of just 2.55%. Last week, Dorchester County spiked to a positivity rate of 7.16%, but after acting aggressively to try to handle outbreaks in crab-picking housing, it is now down to 3.6%. Montgomery County was one of the areas in our state that was hardest hit by the virus in the spring, when their positivity rate peaked at 32.64% back on April 20th. Since then, they have consistently declined to just 3.95% today. 22 out of Maryland's 24 jurisdictions have now met the goal of testing at least 10% of their populations. The state continues to make unlimited quantities of tests available to any jurisdiction that needs them to help address any shortages and delays. And we also continue to strongly advise Marylanders to use our state-operated testing sites, which utilize our Korean lab genomics tests at our state-of-the-art lab that we built at the University of Maryland, Baltimore. We are turning around our test results in just 24 to 48 hours. Unfortunately, because of the spikes and delays in other states, commercial labs across the country are not returning results for 10 days to as much as 2 weeks, which is completely unacceptable. This can render the results virtually worthless in terms of contact tracing and mitigation tactics. On behalf of the nation's governors, we have been pushing for a federal strategy. Yesterday, White House officials committed to a national effort to work with those commercial labs in order to achieve quicker turnaround times and to expand the deployment of more rapid forms of COVID testing. When this crisis began, our cases and outbreaks were predominantly among older people and in nursing homes. But our aggressive testing there is helping to understand and identify and stop the spread of the virus. But in recent weeks, we have seen a dramatic shift in infections in Maryland to younger people. 56% of the new reported cases of COVID-19 are Marylanders under the age of 40. And while the positivity rate for Marylanders 35 and older has significantly declined for more than 12 weeks, the positivity rate among Marylanders under 35 continues to climb. Marylanders under the age of 35 are now testing positive at a rate that is 76.8% higher than the positivity rate for Marylanders aged 35 and older. We are concerned and we're closely monitoring hospitalizations. We have seen a 28% increase over the past 2 weeks. The total hospitalizations for COVID-19 as of today is 571. The current number of ICU beds currently in use is 145. This is far, far lower than back in the spring, but still concerning that we're seeing this rise. And it's also concerning that the uptick in these acute care beds is now largely younger patients. Now, fortunately, they're not as sick. They're sick enough to go in the hospital, but they're not suffering the same severe symptoms and complications as those older, more vulnerable patients who we were seeing in the spring and who were going into ICU and going on ventilators and where we were experiencing more deaths. But, of course, it is troubling nonetheless that they're being hospitalized, and it's further proof that this virus can impact anyone, anywhere, at any age. Thanks to our efforts to increase surge capacity by an additional 6,000 hospital beds, this increase is not cause for immediate alarm from a readiness standpoint. We remain fully prepared and well positioned for a potential future surge if the predicted national second wave emerges in the coming weeks and months. Under our roadmap to recovery plan, this level of increase in our hospitalizations is enough, however, to trigger a stop sign calling for a pause in further reopening plans. We have been fully open in all Stage 2 activities since June 19th. We will remain paused at this point and not move into Stage 3 openings until it is safe, prudent, and thoroughly backed by the data and medical science to move forward. In addition to robust testing, contact tracing is a critical tool to stop the spread of this virus. In the beginning of this crisis, we used contact tracing to identify those who had been infected by COVID-19 and those who they may have been in contact and given the virus to. But now we've evolved our contact tracing strategy to identify patterns and to identify where and how the virus is spreading. But its effectiveness relies on the participation and the cooperation of Marylanders. In fact, without your cooperation, it can't work. It cannot save lives, and it cannot help us keep Maryland open for business. So if you get a call from COVID-19, it's very important that you answer the call and that you cooperate. But by identifying patterns, commonalities, and high-risk exposure locations, instead of shutting down a county or even just one type of business in a certain area, we can often take a targeted action to slow the spread. It's the difference between using a scalpel instead of a sledgehammer, and it is a strategic approach to make smart and data-driven decisions. Today I want to share with you some of our most recent findings, which I think people may find surprising. The number one activity of those who have tested positive recently, reported by a staggering 44%, nearly half of all those who were interviewed by contact tracers who just tested positive, was attending family gatherings. The next highest activity of those positive cases, at 23%, were house parties, and 21% was attending outdoor events. For most of us, I think there's a false sense of security when you're spending time with family or friends, especially if you're at home or you're at a backyard barbecue, or I think I'm guilty of this myself. I think it's very easy to feel comfortable thinking that just because you haven't gone out to what we thought of as a high-risk activity that you're perfectly safe. I know I've been very careful, keeping the mask on, back and forth from home to work, going nowhere. But even I am guilty of this. I had my daughters and son-in-laws and 4 grandkids over, sitting in a room, watching movies with the kids without masks, eating popcorn, hanging out, eating dinner, not thinking that, my granddaughter's going to camp, the daughters and son-in-laws are going to work, and could have been spreading the virus. There are people that are saying, we're not going out, we're going to rent a beach house together with 20 or 30 of our family, and we're staying home. But they're spreading that virus. So it's not just, we want to make sure that we sometimes just think about high-risk activities, but the reality is you can just as easily get this virus just by going to work in an office, or just by attending a backyard barbecue, or hanging out with a group of family. So each of us has to be cautious and vigilant, and we can't afford to let our guard down. Our contact tracing data has also identified high-risk locations. The number one place reported by more than half, 54% of those who tested positive, was working outside their homes. 39% shopping at retail stores, 23% dining outdoors at a restaurant, 23% dining indoors at a restaurant. Not sure what's going on with the slide. Should be. According to our data, for all the positive cases of COVID-19 recently, the largest impacted group of people was healthcare workers. at 25%. These folks are obviously the heroes and are on the front lines every day in a very risky job. Followed closely at 23% of cases by those who worked in offices with non-public facing jobs, which is going to surprise people. People think it's people in bars and restaurants or people working in kitchens. It's really people like us that are coming to work every day in an office or next after the healthcare workers. 13% of the people next were individuals with public-facing jobs, like people in the personal services business or other types of retail jobs. And fourth, at the bottom of the list, 12% of the cases were employees in the restaurant and food service industry. So we cannot say with specificity exactly how they got the virus or where they got the virus, but these are commonalities and they're significant and important tools for our science and data-driven response efforts. I've always said that I would not hesitate to take actions, as we did throughout this pandemic, if and when we deem them to be necessary. And we are trying to do everything possible to keep Maryland open for business in a safe way. The way we do that is pretty simple. People who can telework must continue to do so. And employers should give employees every opportunity to continue to telework. You've heard me say this before, but I just want to be really clear. Contact tracing is showing that teleworking is helping to keep Maryland open and your coworkers and employees safe. And if you do have to go to work or you do have to go out for whatever reason, physical distancing, wearing masks, face coverings, and very importantly, avoiding travel to other states or other areas that are experiencing spiking numbers. So today, I directed the Maryland Department of Health to issue a public health advisory for all out-of-state travel. We are strongly advising against any travel to or from states with positivity rates of 10% or higher. This currently includes Florida, Texas, Georgia, Louisiana, Arizona, Alabama, South Carolina, Nebraska, and Idaho. This public health advisory applies to personal, family, or business travel of any kind. To the extent possible, we advise you to postpone or cancel travel to these areas until their positivity rates decline. If you absolutely must travel to one of these locations, you are strongly advised to immediately get tested for COVID-19 and to self-quarantine while awaiting test results. On April 18th, Maryland became one of the first states in the nation to require the wearing of masks or face coverings. 30 states across the country are now requiring people to wear masks when they're out in public. Based upon what is now solidly backed by the contact tracing data and at the unanimous recommendation of our coronavirus recovery team, not only all of our doctors and scientists, but also our business and labor leaders. Effective this Friday, July 31st, we are expanding the current statewide masking order, requiring now the wearing of masks or face coverings in the public spaces of all businesses across the state. Face coverings will also be required at outdoor public areas whenever it is not possible to maintain physical distancing. This expansion of the masking order is an action that is both fact-based, apolitical, and solidly grounded in science. And while it can be an inconvenience, especially in the heat, wearing masks is the single best mitigation strategy that we have to fight the virus. And the science and the data are very clear. It's the best way to keep you and your family safe, to keep people out of the hospital, and to keep Maryland open for business. If you do nothing else, wearing a mask alone would help us significantly slow the spread of this virus and continue on the road to health and economic recovery. The federal government laid out a county-by-county strategy for recovery, and our safe, effective, and gradual Maryland Strong Roadmap to Recovery, which we announced in April, gives local leaders the flexibility which they requested to take certain actions at their own discretion. And while bars and restaurants have never been fully open and are only allowed to be open for seated, distanced, capacity restricted dining, and they don't appear to be a main part of the issue. We do continue to be concerned about scattered reports of some businesses willfully violating the law and compliance not being enforced. So this is the sole responsibility of local leaders, local health departments, local liquor boards, local liquor inspectors, and if necessary, local law enforcement agencies to ensure that residents and businesses in their individual jurisdictions are in compliance with all public health regulations. Now, in just a moment, I'm going to turn the floor over for a few moments to our Deputy Secretary, Fran Phillips, who's been a fixture at so many of our press conferences. Since before the crisis became a crisis, Fran has been our field general and literally working around the clock, day and night, 7 days a week, to marshal an unprecedented public health response to this global pandemic, helping us to save lives, flatten the curve, and keep Marylanders safe. She's been a trusted advisor to me, a guiding force to our entire team, and a steady and calming presence to Marylanders who are looking for answers and reassurance, and she's simply done an amazing job. Today, after an incredible 33-year career in public health, Deputy Secretary Phillips is retiring. When we convinced Fran to return to state service in 2018, she agreed to give us 1 year. And thankfully, I was able to twist her arm and convince her to give us 2 years. And to tell you the truth, it seems like we've actually gotten an extra 5 years out of her just in the past 5 months of this pandemic. It's a huge loss for us, but a very well-deserved retirement for her. And I have twisted her arm again and convinced Fran to stay on in an advisory capacity as we continue to navigate through this public health crisis. And we're very fortunate that there will be a smooth transition at the State Health Department. I'm pleased to announce that taking Fran's place as Acting Deputy Secretary of Public Health Services will be Dr. Jinlene Chan, who has also been serving on the front lines of our coronavirus response, working very closely with Fran since day one as Assistant Secretary of Health. For the past 5 months, she's been leading our testing task force. She's a big part of the team responsible for the dramatic increase in expansions in testing, which has taken us from 50 tests a day to more than 25,000. Prior to joining the Maryland Department of Health, Dr. Chan served as the health officer for Anne Arundel County, where she developed and implemented initiatives to combat the opioid epidemic, improve the behavioral health care system, and address health and chronic disease outcomes. She completed her residencies in pediatrics and general preventive medicine at Johns Hopkins University, and she also holds a Master of Public Health degree from Johns Hopkins Bloomberg School of Public Health. And while Dr. Chan, you have some very big shoes to fill, I have no doubt that you're going to pick up where Fran left off and continue to do great work leading our state on our road to recovery. Fran, unfortunately, now is not the best time for us to throw a retirement party because you ordered us not to have those. But I would like to present you a governor's citation on behalf of the people of a grateful state for your dedication. So I should have my mask on before I do this, but I'll reach far. Let's give Fran a round of applause if we could for her great work. They can't clap because they're reporters and not allowed to, but Let's get a picture of you. Can we get a picture over here, Fran? Even nice for Fran. I'll hold that for you.
We couldn't clap as we were writing.
Yeah. If I wasn't there to do it. And we're going to end.
Well, thank you, Governor Hogan, for your kind words and for this recognition, which really means a lot to me. And I want to say on behalf of all Marylanders, I thank you, Governor, for your steadfast, no-nonsense leadership as the state, as the country, and in fact, as the whole world moves through these uncharted waters. From the earliest days last spring, when you understood what was coming, you stepped out and declared a health emergency. What the people of our state have seen every day since that declaration is our governor fully engaged, fully informed, and ready to act boldly with preventive measures, as you just heard, when they're needed. But what the public does not see is the time and the effort you commit every day to gathering information, to asking questions, yes, to challenging assumptions, and connecting with others, with other governors, with national experts, with federal officials, and with advisors, all to stay ahead of this pandemic as it impacts Marylanders. Over the past months, you have led a team that has put its heart and soul every day into tackling the greatest public health challenge of our lifetime. Across all of state government, people are working with a pace that I've never seen in my 30-plus year career. And I want to especially recognize the terrific staff at the Maryland Department of Health. Led by Secretary Neal, the Health Department's team has responded 24/7 since the earliest days in late February. Often unrecognized and behind the scenes, the team analyzes lab reports as they come in through the night. They distribute life-saving medication and PPE. They operate test sites, whether it's pouring rain or in the blazing heat. Whatever it takes, the health department folks are giving it their all. And what has been accomplished is truly extraordinary. Over 6,000 new hospital beds have come online. Over 1.1 million tests have been administered. Over 70 million pieces of PPE have been hauled across the state and delivered to nursing homes, to hospitals, and other locations. 1,300 new contact tracers have reached out to interview over 23,000 people, and over 14,000 medical recruits have volunteered for service in Maryland. But none of these successes would have been possible without the support of the people of Maryland. What Marylanders have accomplished together over the past 5 months has been truly phenomenal. Marylanders have shown great conviction to help out, and they continue to do so today. Marylanders made sacrifices in the dark days of March and April, when all but the most essential businesses were closed. As a result, we did slow the spread, and we did save lives. Marylanders found ways to help neighbors, to adapt to telework, and even to adapt to teleschool. Marylanders turned out to volunteer, including the over 2,100 COVID survivors. These are people who have come online, connected with others, and shared their experiences, and are now participating in very important research studies. So I'll always be proud of Maryland's response to this pandemic, and proud of serving on the Maryland Department of Health team of public health champions. A new group of really outstanding doctors and scientists have just recently stepped up to participate, to join the department at this unprecedented time. So our bench is deeper than it has ever been. And no one in the department has been more present or worked harder with good humor than Dr. Jinlene Chan. She's an experienced physician and public health leader, and she sets a great example. Dr. Chan and I have worked together for a very long time, several decades, and we've gone through countless public health crises and challenges. I know that she will carry on the state's public health work with dedication and with resolve. As the governor said, when I was invited to rejoin, come back to the department that I love, it was couched as a one-year assignment. I've loved every moment of it, Governor. It's a little bit more than 1 year, but it is now time for me to return to retirement, for me to get back to my wonderful husband who has shopped and cooked for me and fed me for all these months, and to get back with my children and grandchildren. Governor, at a press conference back on April 3rd, which does seem like years ago, you spoke about making progress in ramping up our surge capacity, our testing, about protecting essential workers, and bringing all Marylanders together. Not knowing then what lay ahead, you called on Marylanders to stay together, to keep going, and to keep fighting the virus. You said our state will make it through this together, and eventually we will come back stronger and better than ever. Governor, you were right then, and your words are right today. We have made great progress, but we have quite a way to go. So Marylanders, I'm talking to you. We need to stick together. We need to honor each other by wearing masks, by keeping our distance, by choosing to curtail in-person activities, and by making smart decisions. We can put ourselves in control of this virus. What we choose to do today will save lives and will keep Maryland strong. And so with that, it's my pleasure to ask Dr. Chan to come forward and to share her thoughts. Dr. Chan?
I apologize for the interruption, but
I'm sorry.
No, you can't.
Your name again, please?
You just have to be a little patient on that.
But not now.
Dr. Chan?
Well, thank you and good afternoon. Fran, appreciate your kind words, and thank you, Governor, as well for your leadership from both of you over the last months and really over the last many years. I really appreciate this opportunity to come on to take steps towards continuing the work that Fran and the Governor have laid out over the last several months and continuing that leadership. You know, as Fran has alluded to, I have worked with Fran pretty much throughout my public health career, both when she was at Anne Arundel County Health Department as well as when she came to the state twice. And really throughout it all, I have really been appreciative of her leadership on a number of very huge public health issues, including on infant mortality and disparities, including on diabetes prevention, and now certainly, as we've been talking about in the last 6 months, about our response as a state to the COVID-19 pandemic. And certainly, as we've been talking about, we have come quite a long way here in Maryland in terms of our response, in terms of our knowledge of the impact on Marylanders. And coming from March 5th, when we had our first case and the governor's declaration of an emergency, to March 11th, which is actually when the WHO declared COVID-19 as a worldwide pandemic, we have taken huge steps and worked around the clock, multitudes of individuals in public health, in healthcare, in private business, in schools, and in so many other sectors to work to keep Marylanders safe. To that end, we have, and thank you again, Governor, for setting targets for us and for really driving all of us to ensure that Maryland has sufficient acute bed capacity to care for individuals if they need to be hospitalized, sufficient PPE and other medical equipment that is also important for protecting our healthcare workers, protecting families, and for treating patients, and a really strong contact tracing infrastructure. And importantly, as we have talked about as well, access to diagnostic testing has been really critical and really an underpinning to all of the work that we've been doing. You know, I recall back in February, March, we were maybe doing hundreds at most a day of testing. And I was looking back, and we did less than 10,000 in a week. And now in recent weeks, we've been doing well over 100,000 tests for most of the weeks in this summer, which translates to roughly 1 to 2% of our population getting tests for COVID-19 each week. And so all of that work, though, comes with all the dedication of the testing task force, the surge task force, and again, all of our partners around the state. And this work has enabled our state to stay open for the last couple of months at phase 2. And so that has been really tremendous in terms of economy. We know what the impact has been on families, on schools, and on businesses, and that is something we continue to keep in mind. As we watch the surge in cases around the country and in our neighboring states, states where my family is from, for example, in South Carolina, we are closely monitoring that because we know that there can very much be an impact on Maryland. And we know, as the governor said, that our borders are porous and people do travel back and forth. And so we are keeping really close eye on that. So I want to reemphasize the messages here. To stay open, we must all continue to stay vigilant. We are still seeing this community spread. And so our numbers, we still see positives every single day. And while our overall positivity rate remains under 5% with the 7-day average, there is still a positivity rate, meaning that people are still getting tested positive. And we are watching our hospitalizations go up. And as the governor indicated, it is particularly among people who are younger, so in their 20s and 30s. So with that, that means now is absolutely not the time to become complacent. What we are recommending are small conveniences, individual small inconveniences, which is a small trade-off to protect each other and to protect our families and neighbors. And so to reemphasize, wear a mask, especially in public places. Under the new order, it will be in additional locations. This has been shown to prevent the spread of potential infection, especially if someone is asymptomatic and is unknowingly spreading infection. Continue to social distance. 6 feet or greater. Avoid large gatherings, whether they be parties or large family gatherings or others. Please do try to avoid those. And wash your hands. These are simple messages, simple activities that can be done and practiced by everyone. And ultimately, the life that you save or the health that you protect may not just be your own, but it could be your neighbor, your friend, your postal worker, your Starbucks barista. So my work with the Anne Arundel County Department of Health was over a number of years, and working with Fran again and many others. And so the experience that I had with the H1N1 pandemic in 2009, then the Ebola response efforts, and our Zika virus disease response efforts, and even with the opioid epidemic, all of those have really reinforced for me the importance and really the critical nature of working together and coming together as Marylanders to confront the threats that could impact our lives, our livelihoods, and really the health and well-being that we all hope for our families. So I look forward to working with the governor and his team, as well as the wonderful team at the Maryland Department of Health, and our many partners across the state in other state agencies, healthcare providers, hospitals, skilled nursing, and others, to continue to the work that Fran, again, has helped to lay the groundwork for, to minimize the impact of the COVID-19 pandemic on the state as we go into the fall and we look into the fall and winter seasons. I hope that these efforts will be able to continue so that we can keep our families and loved ones safe. And I would urge all Marylanders to join me in that effort, because together we can do that. So again, thank you, and thank you, Governor. Thank you, Fran.
Thank you. I just want to say, obviously, we have two incredible women here that represent a whole team of people that really have been working hard. I want to thank Secretary Bobby Neal and Deputy Secretary Dennis Schrader. These incredible women, with the whole team at the Maryland Department of Health has done an unbelievable job working around the clock, and they just represent a whole large group of people that deserve a lot of credit.
Congratulations, Dr. Chan. Look, masks today, not closing down, contact tracing is not showing bars, really restaurants at the hot spots. Is this your hope now that we can stay here and not have to go back? Obviously, it's your hope, you just said it, but is there a threshold that you fear? Is there something that you're looking at? I mean, do you believe that the masks will do it?
Well, we're certainly hopeful, and that's what our plan calls for, and it's what the current federal plan is talking about. Yesterday, the federal government, I think, advised those 21 states to shut bars and restaurants and some other activities, and to shut down all gatherings of more than 10 people. We don't want to be in that position. This was the Trump administration's recommendations to those 21 states. We have about 98% of our economy able to open. It's not performing at 98% because people are afraid to go out in the economy, but we have very few things not open at this point other than large events like football games and concerts and movie theaters and a few others. Everything else is open, but we've done it in a safe and effective way. We want to keep it that way, but a simple thing like masking keeps us from shutting down businesses and causing unemployment. It's great that we have only 8% unemployment as opposed to 25%, and we're doing better economically and health-wise, but looking at these other states, they've been doing pretty well and shot up, and we don't want to be one of them. This, more than anything else, every single expert at the state and federal level says these steps can help stop.
It's over. Just one for confirmation regarding travel advisory.
Yes.
Where we may have individual death.
Yes.
Coming from those states or
Yeah.
and individuals for college. Will there be any type of leniency for that?
Well, so that's why it's a public health advisory and not a ban. So there obviously are reasons for people have to travel. We're still advising them against it unless it's necessary, and if they do travel, that they should still get the test, even if they have to travel for an important reason, like a death in the family, or they've got to leave for a real reason. They should still get the test, and they should still, when they come back, wait until they get that result back from the test. They should still quarantine.
Now, are people wearing a mask in public or indoor spaces? Should you be wearing a mask when you're working out in the gym? There's been some controversy over that because it's tough to work out inside of a gym with a mask on. What's your advice to people? And will you limit gatherings of people? I know you're encouraging people not to go to family gatherings, but as far as large gatherings of people, will you shrink that number down?
If the public health folks feel that we're at the point where we need to, at this point, our group of doctors we just spoke with yesterday unanimously felt that this was the only step that we needed to take right now. And we're watching those numbers every single day. They may, depending on, if those numbers start to creep up, give us another piece of advice. I think it's been clear since back in March, the very first day we got the first case, I declared a state of emergency. Governor DeWine and I simultaneously were the first states in America to shut schools. I was one of the first to put mask orders in the first place. We've done 40-some executive orders. I don't hesitate to take action if we believe it's necessary. But right now, we just don't believe there are any more steps we need to take, but we won't hesitate to take the ones that we believe are necessary.
Governor? Thank you, Governor. About 10 minutes ago, the Associated Press issued an alert that the United States has passed 150,000 deaths, the largest on Earth. This morning, you and Governor Cuomo issued a joint letter on behalf of the National Governors Association regarding these negotiations on the stimulus bill. Governor, this seems to be breaking down along old partisan lines and bickering. Given what we're seeing in the country right now, and the concerns you've expressed about your own state here, how concerned are you that they are not going to be able to work out an agreement on another stimulus bill?
I'm very, very concerned, Tom. I've been talking about this every single week on these calls with the president or vice president, going back since the first or second stimulus bill. The president at one point committed to the $500 billion to the states, at a press conference. They've been saying every week, we're going to work with the states. You remember there was at one point, Senator McConnell said, let the states go bankrupt. We thought we had made real progress. We were very close in the 3.5 stimulus bill. They almost had us included, and then somehow we got left by the wayside. The current proposal on the floor in the Senate has some flexibility on previous money, which is helpful. It has some education funding that's helpful, but doesn't even mention funding to the state and local governments, which is disastrous. The governors are on the front lines providing much needed services to people that really need them. More services to more people than ever. And there's no money to pay for those services. And Moody's Analytics says we may lose as much as 30% of our revenues. And states and local governments have already laid off 1.6 million people. They're talking about 3 to 4 million more. So it's fairly devastating if we don't get this funding. There is some bipartisan agreement among the governors. Governor Cuomo and I together sent this letter. Almost all the Republican governors and the Democratic governors agree, and we've been pushing for this for months. Very frustrated that both the administration, the Trump administration, and the Republicans and Democrats in Congress can't get their act together. And we continue to push. We're going to continue to push. They just came back from a 4th of July recess. Now they're about to leave for an August recess. And, the people in America are still waiting to see if they can do something. And I don't really care about the specifics of if it's a Republican bill or a Democratic bill, we're fighting about this or that. Just get some kind of a bipartisan consensus and get something done. Because to not do something would be a disaster.
You indicated that it's going to be local enforcement on the mask order. Are you planning to contribute any state resources, state law enforcement, to help the local jurisdictions?
I was actually talking about the bars and restaurants, which, there are very few state law enforcement officers, but every state and local government official will be in health department. Everybody else will enforce all of the state regulations, but I was talking specifically about we have no involvement with bars and restaurants because that's only local. They're only county liquor boards and county liquor inspectors and county health departments.
Governor, how likely is it that these actions that you're taking today, or any actions, ultimately stave off a resurgence that we're seeing in other states, or we're starting to see it creep up out of the Sun Belt? Is a second wave in Maryland inevitable? Is it just a matter of time?
Well, I guess time will tell. We're hopeful. You talk to the experts at the federal level, and we talk to them quite a bit. We talk to our experts and our doctors on our coronavirus recovery team. They seem to think these steps will help, but it's by no means a guarantee. We are very concerned that we can't stop people from crossing the borders, things are pretty much out of control in some of these states, and there's no guarantee that we can stop it, but these are steps that could help. They're pretty simple steps, but there's no guarantee. We're in much better shape than we were in the spring, and we're in much better shape than most other states, but it is not a guarantee that we're not going to be in bad shape in the fall or in the months to come. And we're just doing everything we can every day to try to keep that from happening.
Governor, what's trouble, how concerned are you about the Baltimore Orioles and some MLB teams coming into and out of the state, including some of these states? There's no fans there. We're concerned. I think it seems as if Major League Baseball and the Orioles are trying to be very careful about a handful of players. They obviously took steps to stop the Marlins from playing because they tested them very carefully. And I know that they erred on the side of, there was discussions about the Expos playing, and there was the health doctors at Major League Baseball and the Orioles who decided that didn't make sense. They also made the decision not to let the Marlins play after testing positive. So they seem to be taking the right steps, and luckily there are no people attending any of those games.
Hey, Governor, you mentioned that this is that enforcement at the local level is strictly the purview of local health departments and the police department. Are there options at the state level to sanction local governments that you feel are not enforcing the laws enough?
I mean, hopefully we won't get to that point. I hope people will just do their jobs. Look, local governments always have that authority. It doesn't matter what our plan said. It is their responsibility. The state government has no involvement in
bars or liquor licenses or anything like that. There are a handful of state police, but they're nowhere near the size of the county police forces, and that is their job. It's not our job. We're just setting the parameters, and it's their job to enforce it. And we gave them the flexibility which they asked for, which the federal plan and our state plan and what the county leaders wanted was to make their own decisions. Baltimore City, Baltimore County, and others, they didn't follow our plan when deciding when to open, and they don't have to follow our plan when deciding what to close. They get to do what they want.
But do you think that flexibility, though, is an overall good thing? Because if it's county by county, municipality by municipality, and they choose not to enforce your suggestions, it almost sounds counter.
Well, no, they have to enforce our suggestions. They're not suggestions. They have to follow the state law. They cannot do less than the state law. They can do more restrictive, and that's what the state constitution allows for. It's what the federal plan calls for, what our state plans call for. It doesn't matter. That's what they have. They have those powers. Doesn't matter what state orders.
As far as we get into the weeds in this in the next couple of months, you said the state's prepared. Are you concerned that you're not going to be able to get enough tests? How quickly will you go back to South Korea to get those tests if you need them?
Well, the issue is not tests. We have a stockpile of tests, and we're comfortable with that, and we have a supply of additional tests. It's really more lab capacity. We built our own lab, but that's only a portion of the one. We're turning them around quickly, and they're highly sensitive, but we can't do them all by ourselves. Huge portion of this is we have 220 some testing sites that are using labs all across the country. Most of the labs are done by these huge companies, LabCorp and Quest and others. They're the ones that are all backed up. Not us, but we rely very heavily on them. They've been a big part of our solution, and they are backed up not because of Maryland, but because of Florida and Texas and these other places. And so they're the ones. One of them is a median response of 10 days, which means half. That's the midway point. Some of them are 14 days or more. That's crazy. I mean, it's too late.
Has anybody in your cabinet been tested for coronavirus? That you know of?
Tested positive, you mean?
Been tested?
Oh, I think a number of people have been tested, but I don't think anybody in the cabinet has had the coronavirus.
Question about voting. You expressed some concerns about this last week, and there was recently a coalition, if you will, of healthcare people and some people in the NAACP on Baltimore, which expressed some concerns about all this and said that ballots should just be mailed out whether or not people are possible. Could you restate what your position on this is and how you foresee the vote going forward in November when we're hearing these complaints that they won't be able to get any poll workers out there because typically poll workers are older people who are very concerned about this?
Yeah, there's been a lot of confusion about this. First of all, I have almost no role whatsoever in the election process. They changed the law, so I don't even have any purview over the State Board of Elections. They're completely autonomous and independent. The state law requires that they hold an election and that they open every precinct on election day, that they have 8 days of early voting. And that we've always had a provision for people can request an absentee ballot for any reason whatsoever. There's been a lot of things that I've came up with Hogan's plan and this crazy plan. The only step I took was which we can do under existing law, to encourage them to mail that application to every single voter, whether they ask for it or not. That's the only step I took. That was after 30 days of the state board failing to reach any kind of a conclusion on any suggested changes in the law. I was very frustrated that they didn't come up with any kind of a suggestion for how to fix it because it was an unmitigated disaster in the primary. Not only did they not successfully do the mailing of the ballots, the tens of thousands of people didn't get their ballots, they got the wrong ballots for the wrong districts or in the wrong language, but they also only opened a couple of precincts and then had, people being disenfranchised because they had 4 or 5 hour waits and people just went home or they didn't know where to go. And so we're trying to resolve that by having all the above, making sure everybody gets an application whether they ask for one or not. We're only one of 14 states in the country that either mail out an application or a ballot. And I could do that without changing the law. And that was only because they failed to come up with a recommendation. And now we got all kinds of ideas about, we think you should do this, we think you should do that, but it's getting late. 3 weeks ago, I said I wanted them to immediately mail out the applications. I want to know why it's not done. And I understand it's difficult to get people to man the polls, but that's their only job, and it's their responsibility. And the law says every 2 years they have to do that. So we're trying to help them with it. We're encouraging state employees. We're going to give them leave to go help fill the polls if they can, and we've offered to give them all the free PPE. If they have some other idea for how to do it, but they can't just say we're not going to open the polls and we're not going to mail the applications. And they have to conduct an election. That's what they do. All right. Thank you.
Thank you.